Hydrosalpinx is a problem commonly seen in infertile patients. Hydrosalpinx is a blockage of the tubes which are filled with some kind of fluid. Normally, the tubes has an open passageway for the sperm cells to catch the egg and fertilize it. The fertilized egg in this tubal passage goes back to the uterus and implants, and the pregnancy starts. If there is a blockage in the end of the tubes, then it's filled with some kind of fluid in the tubes, and it's called a hydrosalpinx. Hydrosalpinx is a problem which causes infertility issues. If hydrosalpinx is detected, it can be detected by ultrasound, or it can be detected at an HCG, hysterosalpingography. Then it has to be treated in order to get pregnant. Usually women with hydrosalpinx, other than the infertility issues, have ectopic pregnancies. This issue can be solved with laparoscopic surgery. We can either help you to heal the tubes by some kind of surgical techniques to have normal tubal openings, or if it's not possible to correct the tubal problems, we usually remove the tubes, and by this way we help you to get pregnant. If the tubal damage at laparoscopy is too much, it's too severe, then we usually offer you to remove the tubes. If there is minimal tubal problem seen at the laparoscopy, the end of the tubal fimbrial endings can be opened by laparoscopy, and the inner tubal lining, the tubal cells are normal. Then we keep the tubes, we don't remove them, but the hydrosalpinx problem is solved. After hydrosalpinx problem is solved, depending on your infertility problems, the sperm cell, the age of the woman, or other problems, you can conceive naturally from the other tube, or you can undergo an IVF treatment. But if you're having a hydrosalpinx, IVF will fail. So before any IVF treatment, you need to be checked for hydrosalpinx. Hydrosalpinx is usually caused by some kind of infections. When vaginally sexually transmitted infections are not treated, they usually end up in pelvic infections. Pelvic infections, sexually transmitted infections, previous surgeries, endometriosis, and some other kind of causes end up with hydrosalpinx. If you're having vaginal discharge, bad smelling vaginal discharge, if you had histories of pelvic surgeries, then you need to be checked by hydrosalpingography for hydrosalpinx. Hydrosalpinx, when treated before IVF treatments, will help you to get pregnant as soon as possible.